Hi, I'm Molly. I'm one of Dr. Biesman's nurses, and I am here to talk to you to get ready for your UltraClear Laser Resurfacing. So first and foremost, you have made a big commitment to yourself, and we are here to fully support you every step of the way. I know it seems like a lot and intimidating, but we promise we will help get you through it, and you will be so glad that you did it. So to start, we will go through with you, and I will go through on this video how to take care of your skin after we treat it, but also what comes before and just kind of getting prepared and ready to take this on. So prior to your appointment, we will send in a prescription for you for an antibiotic in some cases and an antiviral for everyone. Those are just prophylactic to make sure that you don't get any sort of skin infections or any issues while your skin is healing. So we take extra precautions there. And we also will send in a prescription for something for you to feel more relaxed during your treatment. And you will make sure that you have a driver that day for two reasons. One, because we give you one of those medicines to help you feel more relaxed. But also, so after your treatment, you can just sit back in the car and relax and not have to worry about navigating traffic out of Nashville. So what you do need to get ahead of time also is probably 2 to 3 tubs of Aquaphor Healing Ointment. This is going to be your new best friend and your nemesis at the same time. You'll need to get some distilled white vinegar, just plain white vinegar that you clean with, cheap, all of that. Get a small bottle of that. And then we provide this hypochlorous acid spray, which is a wound healing spray that you'll also be using after your treatment. So you don't need to worry about how you use any of this ahead of time, but this is all for afterwards. So when you come to our office, we will wash your skin, so just come prepared with no makeup on or anything like that. We'll wash your face, we'll get it good and clean. Dr. Biesman will come in, he will mark your face on the areas that we're going to treat with different settings for the laser depending on lines, wrinkles, color, texture, all of that, and kind of to meet our objectives of the treatment. Then we'll apply a topical numbing cream that will sit on your skin for at least an hour, sometimes an hour and 15 minutes. Where your skin will be numb. Now, when we numb your skin topically, it doesn't eliminate all the pain altogether. There will be some discomfort during the treatment, but it will be minimized. And we do everything we can to ensure that you're as comfortable as possible. We have nitrous gas, laughing gas like you have at the dentist that we encourage people to use. You'll have the Valium medication that we've given you to help you feel a little bit more relaxed. We blow cold air at the same time, so we really work to help get you through the treatment. We've never had anybody that's jumped up and ran screaming that they couldn't do it, so we ensure that everybody gets through it and does just fine. But then we'll clean all the numbing cream off, we'll do your treatment. After the treatment, you can expect to feel almost kind of this rush of heat where it feels very, very hot, and it doesn't last very long, but it's kind of this blast of heat. And for a second, you feel like almost a little like, oh my gosh, it's so, so hot. And it's also normal for people to almost get like when you've had a bad sunburn and you kind of get the chills and get kind of shivery. It's also normal for that to happen. I would say probably 9 out of 10 people that happens to. It's temporary, it only lasts for probably about 20 minutes or so, but it's just a normal response in the body, so don't be surprised if and when that happens. But by the time we get you cleaned up after the procedure, the heat is starting to dissipate. By the time we get you down the hall to the car, the heat is about cut in half. By the time you get home, the vast majority of the heat has already dissipated out of your skin. So again, it's kind of this uptick of really, really hot, and then it starts to level off pretty quickly. So not anything to be alarmed about, but just to be prepared for it so you know what's coming. It's normal to have pinpoint bleeding, which can look a little scary, so make sure you tell your partner or whoever is bringing you, friend, family member, spouse, especially male people, like men that are coming who don't understand what it is exactly that you're doing, to make sure that they're prepared for what they're going to see, because there's pinpoint bleeding that underneath the Aquaphor, when we put the Aquaphor on your skin afterwards, can look like it's running down and can be a little bit frightening. That usually only lasts about 24 hours, but it's something just to be prepared for, both for you and whoever's going to be with you. We put a topical product on the skin immediately after your treatment that helps with wound healing. So we'll apply that as soon as we're done, and then we put your Aquaphor on. So that evening that you do your treatment, you don't have to do anything else other than just continuously reapplying your Aquaphor. And when I say to put Aquaphor on your face, you want the Aquaphor to be so thick all the time, and it's a little tricky to get it on there. We will send you home with some little tongue depressors, but you can also use, if you prefer to have gloves, we can send you home with gloves. But the idea is that you want to have the Aquaphor so thick all over your face that it essentially looks white. So like you cannot see the skin underneath. And when you've got a little bit of that pinpoint bleeding and a little bit of this kind of clear yellow drainage that comes out of the skin, which is a normal part of wound healing, it's a little bit slippery. So you can take your fingers and kind of swirl to get it to catch on itself. Sometimes we'll tell people that they can put and cut little pieces of saran wrap to where you can cut that and place it over the areas where you have the Aquaphor to help keep it in place. But just plan to be a greasy mess for the next 5 days, because Aquaphor will be caked in your hair, it will be kind of dripping in little clumps off of your face, all over your house. It's just a mess. The good news is that that's the hardest part, is navigating the Aquaphor. There's not a lot of pain or discomfort afterwards. It's actually pretty easy. And once you get kind of into your routine of what you need to do to take care of it afterwards, people do really, really well. The biggest complaint that we have is that people are ready to get out of the Aquaphor. So in addition to the Aquaphor, we will have you do vinegar and water soaks about every 3 to 4 hours while you're awake. We'll send you with paperwork that has the recipe, but it's a teaspoon of that plain white distilled vinegar mixed in 2 cups of water. So ahead of time, you want to mix like a big pitcher of the water. You can stick it in your refrigerator if you prefer to have it cold. Some people like it at room temperature. You can kind of play with it and figure out what feels the best for your skin. But you'll take, every 3 to 4 hours, you'll take 2 cups of that mixture. You'll pour it in a kitchen bowl. You'll take white washcloths. You can buy a stack of these at Target or Costco or wherever. Wash them ahead of time. And you'll soak this washcloth in the 2 cups of vinegar and water. And you're gonna do these soaks. And what you're gonna do is you're gonna get this kind of sloppy wet, and you're gonna press it and hold it on your face. So the idea is not to wipe or rub or get off all the Aquaphor. It's, kind of an intentional like press and hold. Imagine if you had a full face of makeup on and somebody splashed water in your face and you were just kind of pressing it into your skin in order to not disturb things too much. Then after that, you're gonna toss that to the side, and if you still have some of the solution in your bowl, you're gonna take another washcloth and do the same thing until you've soaked up all 2 cups of the solution. After you do that, you'll still have some Aquaphor on your face. It's intended to be like that, so don't worry about that. Then you're gonna take the spray that we give you, and you're gonna spray all over your face. This can get in your eyes, it can get in your mouth, it can get everywhere. It's totally safe for any and everywhere. After you do that, we'll also send you home with some gauze, and you'll gently just kind of like pat dry a little bit, so that way you can put your Aquaphor back on and not be slipping and sliding around too much. So again, you'll do your vinegar and your water soak, then you'll do your spray, pat dry, and then you'll load up that thick layer of Aquaphor. The more Aquaphor, the better. If you're not sure if you have enough Aquaphor on, just apply more of it. And you'll be applying that Aquaphor probably 20-30 times in a day, if not more than that, because all the time you want it as thick as possible, and it will just kind of Some will soak into the skin and some will just kind of drip drop off. So make sure you've got clothes you don't care about that you're wearing. Pull your hair back. Use old pillowcases, old bed linens, things like that that you don't care about, because it does get kind of stained on stuff. So just be prepared for all of that ahead of time. We ask that you wash everything that you're going to be in contact with in like an all free and clear laundry detergent, something that doesn't have a lot of fragrance, perfumes, dyes, things like that. Have some old towels, even almost like you can wear like a little giant bib. That can be helpful. You can shower, you can wash your hair, even though your attempts to get the aquaphor out of this part of your hair is going to be almost unachievable, so just kind of bear with us on that. Once your skin is healed, you'll be able to really get in there and scrub, but feel free to shower. You can wash your hair as long as you don't let any of your shampoos or body products get up onto your face. And we will keep you in aquaphor until we're ready to let you out of it, in the sense that once we know that your skin is healed enough for you to start coming out of the aquaphor, we'll let you know, because the days to follow your treatment, so let's say you have your resurfacing on a Friday, we would see you on Monday. And on Monday, we'll clean your skin off, because there will be normal amounts of almost that looks like dead skin, or kind of this creamy white stuff that's on your skin. We clean all of that off of you here in the office at your first visit. It's a little bit tender, it's not something that's painful, but we clean all of that up. And then typically at that first visit, you're still gonna be in aquaphor for probably another, I'd say 2 to 3 days. We check you back later that week, and then usually towards the end of the week, when you've reached about 7 days from your treatment, we're able to wash your face, get you in moisturizer, get you in sunscreen, and let you start to tiptoe back out into life in the real world again. So it's a commitment, it's definitely a process. There's a psychological component that goes along with it, but we are here to help get you through it. The psychological component is that we treat you, you go home, you look in the mirror and you think, oh my gosh, what have I done? How did you guys convince me that this was a good idea? And then after you kind of get into your routine, you're like, okay, this isn't so bad. And then by the time we get to days 3 and 4, you're like, okay, this is getting great. By the time we get days 5, 7, all of that, you're like, okay, I'm glad I did this. And then fast forward 3 months, you're really happy you did it. 6 months, you're even happier that you did it. We have yet to have anybody that said that they wish that they hadn't done it. It's a great treatment, and we are here with you every step of the way and available 24 hours a day, 7 days a week. So if you're concerned, worried, have questions, anything at all, you're never alone during this process. So hope this is helpful, and if you need anything else, let us know.